And today I'm delighted to welcome to the studio an award-winning lifestyle genetics pioneer, Avi Lasarow. Avi's unusual in being a serial entrepreneur with 4 successful business foundations in a career of 25 years, including Trimega, a UK medtech business, which he sold for a pretty penny, 8 million quid in 2012. And that's not even the half of it. Avi's currently the Europe, Middle East and African CEO of Prenetics, a global health diagnostics and solutions company, which is pioneering COVID-19 testing solutions in the UK, Hong Kong and South Africa. Avi, great to have you in the studio. Before we get going, I know your clients are very prestigious. You've got the England Wales Cricket Board, you've got the Premier League, you've got Virgin Atlantic Airways. We'll come on to all that, but just tell us a little bit about you.
Well, firstly, thank you so much for the opportunity to be here and share some of the story. I've always been about business and being an entrepreneur, making things happen, and most importantly, making a social impact. And I believe that if you can make a social impact in whatever your business idea is, then of course everything else follows straight after that. So glad to have been involved in a number of businesses, everything from testing for drugs of abuse to, obviously in this case, testing COVID, as well as DNA testing for the purpose of health and lifestyle and how to exercise and eat better based on your DNA. And I think in a world where we're all moving towards personalised health, this is going to become very important.
Now, you're originally from South Africa, from Johannesburg. You're not a medic, but you spent a lot of time as an entrepreneur, as a business leader in this medical space. Why were you attracted to the medical side?
Well, I think, as many entrepreneurs do, you just get attracted to a sector that has most interest to you. So in my own case, of course, I went through a personal situation around DNA testing, which then drew me instantly into that sector because I experienced a service that I thought wasn't done very well. Yeah. And I looked immediately to innovate and do it better so that when the next person went through that experience, they'd have a better one and therefore potentially choose our company, but raise the bar in the sector generally. So always looking for innovation, always looking for ways to raise the bar and provide great social impact and great service at the same time.
So often the way, isn't it, Avi? Business leaders, entrepreneurs get their ideas from just living their life and seeing things that they don't think are done properly, so they resolve to do them themselves. Now, obviously, the last year, 18 months, has been a huge moment for medical research in the UK, particularly with our vaccine rollout. In the round, to what do you think the rest of the world thinks of the UK's vaccine rollout? We were very quick out of the blocks with the approval of vaccines. Obviously, Oxford University, other UK research centres too, absolutely at the cutting edge. How's our vaccine rollout look like now? It seems to me lots of other countries have surged ahead of us.
So just briefly before answering your question, to contextualise for yourself and the audience, of course, 18 months ago we were a 30-person business. Today we have now more than 550 employees here in the British life science sector. So really proud of that. And, all, of course, working true to our mission, which is about bringing health closer to your home and closer to the individual. So, of course, when the pandemic impacted us all, it was an opportunity for us at Prenetics to actually live that mission more closely. And we very, very quickly moved into providing an excellent service across multiple clients, throughout the world, actually, rather than just the UK. To fast forward to the great success that we've had in terms of the vaccination program, it has been a great success. I think we all know that. We all live in testament to that. But of course, what we don't share the successes of is the little ships like ourselves, like Prenetics, that have played a great part in bringing together laboratory technologies, investments and services to the consumer more generally. So, of course, it was like running the big engine room when everybody needed testing and government wanted to essentially look after their testing requirements for healthcare services and NHS workers. Little ships, smaller companies like ourselves, help to develop a world-class service to the general population. So this investment in life sciences will live a life beyond testing for COVID and will become much more greater used for other such services.
I think it's fair to say, isn't it, Avi, without pointing fingers, but this vaccine rollout success, yes, the government was there and helped to kickstart it, but it was a private sector success story, wasn't it? Small companies like you following financial incentives and getting your ducks in a row, rather than an NHS success, even though the NHS were involved to some extent with the rollout.
Well, I think on the vaccination program in particular, I'd like to just say it's a great success, and I wouldn't want to take credit as a private company or a private sector initiative in its own right. I think in this case, government came together with private sector to generate a success story, rather than just one part of the, the UK's business sectors. we're not involved in the vaccination program ourselves, but we've been involved in other successes coming together with government, where private sector and government have worked together to innovate, to bring things forward into the market. And I think that's what's really important, right? That ultimately, there is a place for fast innovation. The vaccination program demonstrated innovation in healthcare and getting a product to market very quickly. The same has happened with testing capability, new initiatives, and I think this speed that we've now seen in the last 18 months will become almost a recipe for other success stories in this type of industry.
What would you say to those watching? Maybe you can help us shed light. Your own business has grown quickly in the last year or 18 months. A lot of people watching will think, why is it that my relatives in other parts of the world, other parts of Europe, they've had their PCR tests have been much, much cheaper here in the UK. The evidence is undeniable, isn't it, Avi? PCR tests here have been much, much more expensive than in other parts of certainly the European Union. Why is that?
Look, I think, different countries have different, requirements in terms of their testing programs and regimes. I mean, certainly as a company that have been at the forefront of providing private PCR testing, we've done our utmost to bring that cost down as best we can. In fact, we even campaigned for taking the VAT off COVID tests, which we thought was quite important, right? But saying that, I think...
Which the government never did, of course.
No, they didn't, but certainly the awareness about driving the cost down.
But private companies could have, if they didn't get the VAT lift, they could have, cut into their margins. The margins on this have been huge, haven't they?
Yeah, well, I think our approach, and I've been privileged to come into GBNews to talk about exactly this topic, it's all about quality of service. So, for example, if you want to, in the case of the travel industry, where we focused on this PCR testing requirement, provide a great service, have a call centre with, in our case, 120 people, have the ability to help anxious travellers, by way of example, be less anxious, that comes with an infrastructure, and an infrastructure comes with a cost. So as long as you're a responsible provider in this sector, I think there's a cost justification. But talking about us, we're not a PCR testing company. We're a life sciences health testing company. The global diagnostics market is worth approximately $1 trillion. And what we see, and what we are hoping to very closely stay attuned to and move into, is that this health diagnostic market is going to now become a home health diagnostic market. So we're bringing products to market where you can test in your home, whether it's for a PCR test at sort of PCR quality, a COVID test at PCR quality, whether it's things like sexual health, whether it's things like diabetes. This will all be able to be done in your home in the future, and we're proud to be part of that and championing that exact initiative.
That's really interesting, Avi. So while your business has grown a lot, you talked about the employee numbers yourselves, a big multiple increase during this COVID pandemic, and your firm has been involved to some degree in helping to roll out the PCR tests and help people meet those government requirements and so on. Can your company keep growing at the rate it is, or at least maintain its existing side once we move to a post-COVID world where we're not all having to get PCR tests? Well, we're not now, are we? We're mainly relying on lateral flow tests now in almost all cases when we travel.
Yeah, I mean, as indicated, we've just been privileged to be supporting the COVID requirements, whether it's PCR testing or lateral flow testing, for example. But our core business is about DNA testing generally. It's about colon cancer testing, for example. It's about the future of where health is going to go. And, we're well positioned with a strong product pipeline to make sure that as we've all now become accustomed to self-testing and what we call home diagnostics, that we would be able to service that market greater. I mean, in the UK, for example, the NHS is moving to community diagnostic centres. So they're trying to shift the burden from the NHS into the community.
From big hospitals
Absolutely.
Or even the GPs to this kind of interim facility where people can get tested more conveniently.
Exactly. So if you look at Prenetics across the country, we have now 35 health pods around the country that we used for the workplace. Before you went to work, you could get a test of some sort. So we'd hope to disrupt that whole space and actually offer other tests. Would hopefully help to bring those pods into life for this community diagnostics opportunity. So I think as we see the democratization of health into the home and into the community, what we'll then see is companies like Prenetics. There are others out there who are attempting to the same thing, help facilitate and accelerate that pathway. And I think that's really exciting.
So people who aren't really up with the science and the latest in the industry, as you obviously are, Avi, tell us some of the conditions that can be home diagnosed or diagnosed much more simply without going to a hospital now that couldn't be, say, 5 or 10 years ago. Where is this heading?
Sure. I mean, there's big markets for male care, fem care, as we call it, without getting too technical, looking at things like markers for diabetes. HB1AC is the technical blood marker, for example. Sexual health is a very big market. If you look at our colleagues in the US, I mean, subscription sexual health services is huge. I mean, people who, choose to live a particular lifestyle have an essence of responsibility, so they would subscribe to these sorts of services as opposed to going into a clinic. And I think all these sorts of testing services from your home will take pressure off the NHS and will help us all think about our health differently moving forward as a lifestyle than otherwise.
But just to reassure viewers, there's no way, or is there, maybe you can inform me, that things like cancer diagnoses, MRI scans that do involve, heavy, important, very expensive hospital equipment, there's no sense that the provision of those is going to be reduced because of this sort of home diagnostics revolution, is there? No,
I don't think there's a sense that it will be reduced, but I think you'll see what's termed as an asynchronous hybrid model, where you might be able to get certain bits of information at your pharmacist or in the community diagnostic centre, and that will be wrapped around in a package electronically, safely, securely sent to a physician who could then obviously look at that, a clinician. So I think that what will happen is you'll see innovation in healthcare, you'll see different models coming together. The consumer will be much more sensitized to, continuing through those pathways as they have never done before because of the pandemic. Because we've swabbed ourselves and our children on a frequent basis, it won't be an alarming thing to do a swab or do a test at home in order to get your health report sent to you at some point in the future. So I think that's definitely the way it will go. Where does
GB UK stand internationally, Avi, in terms of the use of these home diagnostics compared to, say, America, compared to mainland Europe, compared to Japan?
Well, I always like to talk about genomics, right, in the context of the UK. So I would say that the UK is at the forefront of the genomics revolution. I think there's a huge appetite now and a huge shift from one pill per person, or one pill per everybody to one pill per person. And I think that's where it's going to go, personalised health. And so the UK is positioned very, very well. I mean, a lot of the variants which we are now finding out relate from the pandemic, are actually discovered in the UK. I understand Porton Down, for example, are sequencing on a regular basis. That's because we have such a great sequencing capability, meaning we can look at your DNA, and through your DNA we can determine if you might have what's known as a predisposition to a type of cancer or a type of genetic disorder. And I think, even in the last 24 hours, we've read in the Times that, cancer diagnosis and treatment is going to be much more precision orientated because of genomics. And I think that's going to help us all move to a different world in terms of treatment. You look at countries like Estonia, I believe approximately 25% of the population are genetically tested at birth. So when you get to the doctor and the doctor gives you a prescription, they give you a prescription that's built upon your DNA. That's right for you, not right for everybody as they would have prescribed in the past. So we're going to see huge acceleration. We already have, and I think the pandemic has helped that acceleration move forward. And companies like Prenetics are positioned very well because of their investment in the sector to take advantage of that.
It's very interesting. Just finally, Avi, you're not a medic, as we've said. You don't claim to be, but you are very experienced in the economics of medicine, and particularly in the space that Prenetics fills. So let me ask you this. I think a lot of viewers will be interested in your answer. Where do you think we are now in terms of COVID? Do you think the UK can now really grasp this post-COVID world? In your heart of hearts, do you think we're properly through this, or mostly through this now?
So I think in my heart of hearts, as a business, we see that there will always be a form of testing moving forward. As a company, we work with a number of airports. We have laboratories with our partners at airports, and testing.
Do you think COVID testing is going to be around? It'll just get easier and cheaper?
I think that there'll always be a sense of testing around. I think the UK, as we know, as other countries are moving to an element of surveillance testing, whether it's within wastewater samples, for example, looking at protecting our environment through different technologies. So I think testing and surveillance protection from the environment perspective in health will be here to stay for sure.